Hello everyone. On the behalf of Pakistan-U.S. Alumni Network, I welcome you all to the PUAN live session on COVID-19 and protecting yourself. Let's start with my introduction. I'm Sabeen Farooq and I'm an Access and Exchange alumna. And I'm the Managing Director at Vision Building Future. Currently, I'm working as a TV anchor at PTV and ATV. And I also worked as a youth group director at Pakistan-U.S. Alumni Network, Islamabad chapter. We all know that everyone is going through very tough time because coronavirus is spreading all over the world, and we all are so worried in this situation. So in this difficult time, U.S. mission in Pakistan, in collaboration with Pakistan-U.S. Alumni Network, has launched a virtual series of discussions on topics and themes catering to the needs of interest and more than 29,000 alumni community across Pakistan. And using digital resources, PUAN wants to connect with the alumni to maintain sustained alumni engagement, awareness, and protection. In today's live session, we will discuss about COVID-19, and we will try to educate people about the situation of coronavirus, precautionary measures, facts, and information through our experts. Everything discussed in this session is solely based on individuals' opinions and personal experiences. We have amazing guests with us today, and let's start with the introduction of our guests. So we have Dr. Abdul Manan with us. And Dr. Abdul Manan is currently working as a resident physician, FCPS, internal medicine at Hayatabad Medical Complex, Peshawar, and part of Corona Combat Team. He's also spokesperson of Provincial Doctors Association, Khyber, Pukhtunkhwa. He holds a master's degree in political sciences, apart from MBBS degree. And he avails State Department sponsored program SUSI Comparative Public Policy Program in 2013. And he remained a member in Youth Parliament in 2009 to 2010 and writes blogs on Health Times Pakistan. Welcome, Dr. Abdul Manan. Next we have Dr. Mohammad Zaeem with us, and Dr. Mohammad Zaeem is leading from the front in the fight against the coronavirus disease as a district health officer, and he is a medical practitioner by profession and recently joined the Ministry of National Health Services, Government of Pakistan as a DHO. Zaeem completed his master's in public health on the Fulbright program. Earlier, he served as a district coordinator, national program on family planning and primary health care in Gilgit-Baltistan. Welcome, sir. How are you? Okay, so Dr. Naeem, please unmute your mic because we can't hear you.
Yeah, I did. Thank you, Sabeen, for getting me here.
Yeah.
And I thank everybody live here listening to us today. Thank you.
Yeah. Let's start our discussion. I can see you both are working actively and very hard in this difficult time and to protect our people of Pakistan. So I want to ask from both of you to please share about your work and how you are helping your community, starting from you, Dr. Zaeem.
It's a global challenge, and fighting it alone is not something that everybody would recommend. It's a collective effort, work, and all the countries across the globe are trying to fight coronavirus pandemic. At this point, the thing that we are following is to do extensive surveillance, and for that we have to go on the front line and to train all the people, because we had dearth of people who would want to serve on the front lines, and also like the technical capacity of the people who want to get trained and fight against corona. It's been an interesting journey since we have joined this, and it's been 2 months. We are fighting on the front line. We have trained almost 100 people in Islamabad only to fight on the front lines, to diagnose, to train, to track, and to test and to quarantine the people who are suspects, who have been traveling, who have been in close contact with somebody who had been diagnosed with coronavirus. So far, Islamabad, we have been pretty successful to contain it since the first virus patient showed up in February, and until now, we have 194 patients. So it shows that surveillance of this disease is key, uh, and this applies everywhere across the world, because if you do the surveillance, you're trying to contain the virus to the people who are infected, stop it from spreading to others.
Mhm. So, Dr. Zaeem, you are working, in the field, and so what is the attitude of people towards this outbreak?
It's a mixed, mixed reactions from people. Like they sometimes they don't take it serious, and I have been telling people about like trying to appear on national media and also through social media about this gravity of the situation, and look at the countries that affected. Look at Iran. Look at Italy. Look at US. Look at all the
Hmm.
major it has hit, and it is hit really hard. In Pakistan, it has been pretty much not impacting as it has done over the countries.
Hmm.
Some they just listen to us and they try to just stay home and don't come out, do quarantine themselves. But some of they don't listen to us, and we are trying to give them images that how it impacts your family, your children, the elder ones. Know that a young person will not impact you as much as it can. Elderly, we are being a source of spread, and we are being bringing to the elderly population, which it can really get.
Yes. Okay. So, Dr. Zaim, a very important and common question we can ask from a doctor or an expert. So, what are the key personal protective measures that a person can take? So, can you please explain the right techniques and mechanism for taking such personal protective measures?
It really depends where you're working. Like if you're working in a clinical setting, it's different. If you're working in a surveillance system, it's different. For us who are working on the front line to find out the patients and to observe their health over the period of time, we maintain a distance of more than 6 meters. Um, we try to not interact with it because we can be a part of the super spreaders if we have the virus and we interview people. Uh, our risk is people who take the sample. We have team of people who go out there, their houses, samples, nasopharyngeal or oropharyngeal samples, where the risk is that a sample, meanwhile, the person could gag, could sneeze, or maybe sometimes as a knee-jerk reaction, they tend to grab you. So basically,
Yeah.
you can get it. So we ensure that our frontliners who are taking samples wearing proper PPEs and face shields and all the TIVX suits, so that we help them as well as we keep us safe. But for in a hospital, it's completely because
Hmm.
setting and they have to uh, all the PPEs, hospitals, and it is very cautious because you don't know how can you contract super spreader healthcare providers.
Okay, so Dr. Zaim, I can see a lot of people using one mask for several days. So isn't it dangerous? What is the proper use of mask? Can you please educate people?
Normally, the mask should be, it depends on the setting again. If you are setting in a high risk area, we don't, for my teams, I don't really recommend them to wait within like 6 hours because when you are you're touching your, mask by and again and you just leave it somewhere and then you grab it, you're increasing the risk of catching the virus rather like protecting yourself from the virus. So we don't.
Okay. Okay, so how is this disease spread from person to person? So What do recent studies reveal regarding how the virus is spread? Please share your thoughts.
Okay, there are multiple ways that this virus can spread, and this virus specifically is very tricky. Has the higher, the rate of virulence. It has highest virulence, and also that it can spread from a person to person. If the person is in the same room in a meeting, if somebody sneezes, coughs in the form of aerosol, and also like shaking hands and later you touch your nose, eyes, or ear maybe, mouth, and also in the form of water, other resources where the kids in the and somebody who's infected is washing their hands somewhere, and the kids put their feet or maybe their hands into the water, or anybody else who can contact the skin.
Okay, so Dr. Manan, are you here with us?
Yes, I am.
Okay, so Dr. Manan has joined us. So, Dr. Manan, can you please share your work, your experience, because you're working in the field? So, how you are serving your community?
Okay. Hello, hi to all. First, thank you, Sabeen, and thank you so much for having me today at this panel. I'm so grateful to be here today with you to have this conversation on this very important topic, probably the most important topic right now. I I want to appreciate my PUAN family, the United States State Department, U.S. Embassy, especially our alumni coordinators, for initiating this series. Now about your question about my work, as you said, you have already introduced me in a fancy way. I'm a resident physician, FCPS at the Department of Internal Medicine.
Yes.
Hayatabad Medical Complex work is one of the tertiary care hospitals in the city of Peshawar, and it's one of the designated healthcare facility for the COVID patients as well. Last week, the Prime Minister paid us a visit to encourage us and praise us a lot for the quality of care we provide, especially for the COVID patient. Over here, the arrangement we made, the tried system we developed, and we are first up the kind that we prepare our own PPEs in the whole province. Currently, I'm in the thick of it, as it were. I'm proud to be part of the frontline staff, the COVID combat team, and I've served the Corona isolation specified for the COVID positive patients. And further, I represent the doctors across the province of Khyber as I am the spokesperson of the Provincial Doctors Association. So far, we have met with the health ministers and have had many press briefings to raise the problem faced by the health care workers, and I would call them the frontline soldiers nowadays.
Warriors, yeah.
Yeah, the warriors. Either they are the doctors and the nurses, or the paramedics and other helping staff. Through the platform of PDA, the Provincial Doctor Association, we have raised funds to procure the PPEs, the personal protective equipments, which include the mask, the Tyvek suit, the astronaut suit, the gloves, and so far we have distributed them in the far-flung areas of Pukhtunkhwa, like Shangla and Bonaire. With the help of generous donations by individuals, organizations, and some political parties as well, and I intend to raise more funds. I would ask for help, as the government resources are scarce, as Dr. Zaeem mentioned. They may not be able to provide those PPEs everywhere for a long time. So I would like to avail today this opportunity to ask my alumni brothers and sisters to come forward, help me out in this noble cause. Do it for yourself. I can guide you. You can help directly with the effecties. Distribute the PPEs at the places where they are needed the most. And this is the kind of help that is needed more than ever.
Okay, so Dr. Manan, we have many alumni working in the field to support community and institutions. So what kind of precautionary measures do you suggest for them if they choose to continue their work in the field?
There is an old age saying that we are all well versed with. prevention is better than cure.
Exactly.
Rather than an arbitrary saying, is instead it is one of the most important and fundamental principles in medicine, especially the preventive medicine, which is need of the day. If one bears that in mind, then the importance of safety and precautionary measures become even more important, especially when it involves lives. That day, I was watching one of the interviews of Dr. Anthony Fauci. You may know him. He is the director of Allergic and Infectious Disease Center, United States, and currently working as a technical advisor to Mr. President Donald Trump. And he was asked about the seriousness of the situation and the pandemic outcomes, and he replied, and I would like to quote, I have been asked all my life, what is your bigger fear about infectious diseases? And my answer would remain persistent, and I would always answer like this. I fear of a human respiratory virus that can transmit from human to human. And that what corona is. It's a pandemic.
Yeah.
I would like to elaborate on this pandemic word. Pan means all, and demos or demic means it pertains to a distinct a group of people or a population of people. So no one is safe in this pandemic. All the human beings, the Homo sapiens, the species across the globe are involved. Over 200 countries are infected. Almost all the world is under lockdown. Superpowers, world powers are
Yes.
helpless, just helpless. It's enormous. It's engulfing everything. And
Yes,
this
so
is
Dr. Manan, we are going through tough time, but I can see our alumni working in the field, and you both are also our alumni. You are the alumni of Pakistan-U.S. Alumni Network, and we are so proud to have you guys here. And would you please share your ideas how alumni might provide assistance while abiding by restrictive movements and social distancing policies, Dr. Zaeem?
Yeah, at this point, we need volunteers. If somebody would want to volunteers in terms of IT. If somebody is working on IT, then we have to map different areas and the spots of coronavirus outbreaks. And there are packets in Islamabad that we need to make the clusters out of it to intervene at the right time. And also, if somebody who's medicine medical professional or public health should step forward, we can take them aboard, guide them through different surveillance and different, surveillance side, like I said, which is this virus. And also, if somebody is a doctor who can actually visit the hospital, and also if somebody who's in any form, like if would want to like maybe come make chai for somebody, like tea for people who are working in the surveillance, we welcome them, and we'll make sure if somebody comes, we'll make sure that they remain protected and right equipment at the right place, at the right time.
Yeah. So, Dr. Manan, as you have mentioned that you're working directly in the field, you're on the front line. So, being related directly to the health department, so what precautionary measures do you practice while completing your duties or dealing with the COVID patients?
yes. We follow all the standard protocols, wearing the PPEs like the Tyvek suits, wear mask, the N95 mask that provide the maximum protection. And apart from that, we use gloves. All the PPEs we use them. Apart from that, we usually handle patients while taking a sample from a patient. There is a both. We usually take sample in that both. And apart from that, every patient is labeled. Either it's confirmed case or it's a suspected case. But we take every patient as a confirmed case. We never take the rest. And apart from that, we use disposable PPEs. Like if I visit a suspected patient and that later on comes out positive, and in those PPEs I visit another patient that is suspected and that may come out negative, then I may be transmitting. That's why we use disposable PPEs to have maximum protection to ourselves and the people we are treating.
Okay, so Dr. Zaeem, what are the psychological aspects of this emergency situation due to COVID-19 in your opinion? Because people are so scared these days.
Yeah, they have a lot of reports of different type of right now. A lot of organizations stepping forward to help us with the mental health side of it. In Islamabad, for example, we have now established telemedicine. Psychologists and psychiatrists will help people in areas who are locked down. People cannot go see the patient and help them go to the people part, make them realize that this is how they react, strengthening their willpower, strengthening them through different maneuvers, different practices. There has been different reports of violence, as well as a lot of other. So this comes as a part of the pandemic, and this comes as a part of the social impact and the mental health impact of coronavirus at this point.
Okay, so Dr. Manan, in the face of COVID-19, social media can be a great way for individuals and communities to stay connected even while physically separated. So how can social media or technology be helpful during this pandemic?
Yes, quite a lot. It can be a source of reliable information. We can, in this period, an unprecedented time, this can be a source of connection to our loved ones. Uh, if we cannot visit our grandma, grandpa, we can talk them with the help of social media, with the help of a video call. We can help out someone, we can educate someone, we can telemedicine, like the idea Dr. Zaeem just gave, that health professional can telemedicine, helping to provide consultations online on calls. And Provincial Doctors Association has started such an online clinic for this. We have received thousands of calls so far, and thereby potentially reducing the number of people needlessly visiting to hospitals. And on the flip side, it can help weed out those who are actually unwell and guide them to seek the appropriate care. This way, it will very reduce the burden of patients on the already crippled healthcare system of our country. Social media, we can create awareness about the hygienic measures, the precautionary measures, like we can teach all the public the right way of the importance of hand washing, the personal hygiene, the correct way how to hand wash, and what features are related to corona patient, and what is the symptomatology. Anything we can educate our masses, and we can connect them, we can educate them. It can do miracles if we use our social media the right way.
Yes, so but there are a lot of people I can see because I myself is very active on social media, so I can see a lot of people posting myths about coronavirus and all that, because we all become experts when it comes to social media. So how to deal with it?
Yes, you are quite right, and in that sense, we can make use of reliable sources like the WHO platform. We can have help from the CDC website, and right now I can see the Facebook has started an info tab. Right when you start at the start, there is an info tab directly taking you to the WHO website, so we can combat those conspiracies like many people says that the nostrils of Chinese are this much wider and our is that much. So there are a lot of conspiracy theories and misinformation on social media. This is the disadvantage associated with social media and the new millennium.
Okay, yes, so Dr. Zaeem, can you please specify a few social media sites, reliable, authentic sites that people can, collect information from?
They're international and they're national. I think for national, we have Ministry of National Health Services regulation and they have all the SOPs regarding, prevention, disinfection, burial, treatment, disinfection, and a lot of it. And also then there are other websites like Dr. Abdul Manan mentioned, CDC and WHO website, as well as the rest of the world.
Okay, so Dr. Zaeem, what suggestions would you give to the public as they seek to comply with government policies related to fighting COVID-19?
I suggest them to stay home. I think that's the best part we can do. And not spread fake news, maybe. And also, I see a lot of, messages on WhatsApp, Twitter, Facebook, which is sometimes, information that is not right. So basically, try not to spread fake news and also tend to, follow the preventive measures, do the social distancing thoroughly, and also help others understand the COVID pandemic situation and the amount of taking. So the best part, stay home, relax, and let us do our work. And let us, the nurse, the doctors, let the by the laws. Sometimes when we advise people not to come out, but they still just come out for any reason. That's the part I want to, want a platform and all the who on family to spread this word and ask people to stay home.
Yes. So, Dr. Manan, we are getting questions from audience as well. So, someone is asking that for how long does the virus survive in a body?
Okay. It's not about the survival. It's basically there is a term called a transmission period. If somebody gets infected, he or she usually shows symptoms after 5 to 14 days. During those 5 to 14 days, that patient can transmit the disease by contact, by sneezing, coughing, making aerosols. Whoever is can gets in contact with that patient, that person will get infected. Now it depends on the titer, how much exposure is there. Definitely the amount of virus that you are exposed to. The symptoms depends on that. A person, if exposed with any PPE without any mask, in direct contact with one weed, that person may develop severe symptoms. But the person having minimal exposure, there are some studies, evidences that shows that the titers is also significant.
Okay, so Dr. Zaeem, what do you say? So, Dr. Zaeem, we can't hear you. Please unmute your mic.
Yeah, it takes 2 to 14 days to for the symptoms to come out, and then what we really suggest at this point is, say, if somebody's in, and if they have symptoms and they come out positive, quarantine them for 14 days if they don't have any symptoms. Now, 14 days, what we do is we conduct our second test, and if that comes negative, then we conduct another test 24 hours later, which is the reconfirmatory. to make sure that the person is virus free. And if he or she is virus free, we notify the person as COVID free and give them suggestions and advices how to care or himself and how can they help others to understand what are the can they fight this disease? How can they prevent this disease from spreading to others?
Okay, so Dr. Manan, we have another question. Usman is asking that, do you think that common people have started to take this pandemic less serious now and not being responsible anymore?
Yes, I would agree with him. Yesterday, while at duty, I observed that more people are coming in the ER. They even were not wearing masks, simple surgical masks. People are getting used to this pandemic now. Now that their approach is being a little bit different. At the start, they had fears. Now they can see that in Pakistan, due to some factors, due to the effective lockdown of the government, the cases are not that high, and further the testing capability of our system, the health system, is very low. So the actual number of patients that are out there are not tested, and the government statistics are well low than the actual patients. So people don't care. People think that the number of deaths are low, the number of infected confirmed people is low. So their approach is now different. In my village, there is no practical lockdown, and the government cannot impose lockdown. The government cannot go to your home and force you to ask you to wash your hands, and then the government cannot ask every single person to wear a mask. That
Exactly.
depends on us, and that's after all, it's our life. After all, it's our health. After all, it's our loved ones that will get infected. I would like
Exactly.
to tell Usman and the rest of the masses that even asymptomatic person can cause the disease, can transmit the disease. So
It's
take
because
good
they don't
care.
know that they are infected, right?
Yes, exactly. That's the reason.
Okay. So, Dr. Zaim, Hamza is asking that what is the actual cause of this virus? I think we all are confused in it, but what do you say? Can you please unmute your mic? We can't hear you.
Because this
Yeah.
is virus. There has been viruses similar to this one before, but not exactly the same one. SARS has been there, but this virus acts completely differently. It has different symptoms. It depends. It exhibits its symptoms differently in person to person. Some of them might not have sore throat, might have fever. Some of them might not have body aches. Some of them might not even show any symptoms. So at this point, not a lot of research there to support any of the ideas. But how did it start? Still a question for me.
Yeah. Let's not get into that. So,
Fair
Dr.
enough.
Manan, so someone is asking that any test center for southern districts, Karak, Bannu, yes, please provide the details.
Recently, the health department of Khyber Pukhtunkhwa started 3 new centers, testing labs, public health lab. One at Abtabad, the other is at Sawat, and the new one is at our hospital, Hyderabad Medical Complex. Unfortunately, the southern region, the southern belt like Diya Khan, Karakhangu, and Kohat, they have to send their samples to the public health reference lab of Khyber Pukhtunkhwa, Khyber Medical University, or the National Institute of Health Islamabad. Government is planning in a meeting with health minister. I have seen the plans, but when that materialize, I don't know. They are planning to have a lab at the DA Khan teaching hospital, the government medical college, because there is a big quarantine center for the passengers coming from Iran. That's why there should be one.
So you have mentioned NIH, and Nisar is asking that I have heard tests NIH. So can you please update about the process?
I have a comment on what Abdul Manan had said.
Yes, please.
After the National Institute of Health, and the National Institute of Health is the it's a health institution where all the testing happens, and then when this began, I think we had the capacity of conducting only 1,000. Now we have beefed it up to 11,000 per day. So that's a huge addition to the testing, and not just in Islamabad, it's across the country. In KP, in AJK, Gilgit-Baltistan, and all the provinces. Just for a comment.
Okay, so Hamza is asking that is this virus less effective at high temperature?
No, that's a myth. This is so popular in the public. I have come across so many studies that the humidity or the temperature has nothing to do with the spread or transmission of virus. People used to say that let the summer come and then the spread will decrease. No, do practice the hygiene and precautionary measures. Practice social distancing. Practice good hygiene measures. Frequently wash your hands. Don't wait for summers. For God's sake, please be careful. Take your good care of yourselves.
Exactly. So, Dr. Zaeem, someone is saying that what is the best way to reach out to you? And I am in the IT sector and wanted to discuss ways I can be of any help with your current needs on COVID-19.
Yeah, so it's our office in Islamabad is the offices that basically they can reach out to. We have many volunteers working for us right now, and they're lab technicians, they're biomedical engineers, they're also lawyers, just volunteering with us. We have an office in G9, and we have an office in F5, Ministry of National Services. Either way, they can. We can share our email address. They can reach out to us, and then we can depute people, the volunteers, to the right places, positions that they would want to.
Yeah. Okay. So, Dr. Manan, there's a question. I and my mother are known as asthma patients. Care we must take and how to consult our physician as OPDs are not working. So is it right that OPDs are not working these days?
Can you please repeat the question? I wasn't able to.
Okay. Okay, so someone is saying that I and my mother are known asthma patients. So in the month of April, we usually have asthma attacks. So what care we must take, how to consult our physician as OPDs are not working?
Yes, OPDs are not open, and it's because of a reason. We know the reason. Because usually old age people mingle with the younger ones, and the younger ones may have the virus and don't have any symptoms, and they could transmit. That's why OPDs are not open. And about the asthma, the person is right. Whoever he or she is, asthma usually exacerbate during the spring season because of the pollens. Simple reason. He can call to us via the telemedicine online clinic number. We can better help him. General guidelines. I would advise them to do not expose your mother to pollens, dust, any allergen, and comply with the medications. the steroid she inhales, the bronchodilators she use, stick to the
Yeah,
medication,
so
and
yeah, their regular medication that their doctor suggests. Yeah,
yes,
okay.
exactly.
Yeah.
Whatever is the
So
course
yeah,
of treatment that should stick with it.
bilkul. So Ashab Khan is saying that I read it somewhere and heard through people abroad that there will be a second wave of this COVID. Is this true? We are already scared.
Yes,
Ashab?
yes, it's very much true, and I am very much afraid of that. When the
Really?
lockdown ends,
Huh.
there will be definitely a second wave, and we better to have a good preparation for that. And Zaim would better answer that because he is a government
Yes,
official.
Zaim, Dr. Zaim, over to you.
Yes.
There has been incidents where the people who are infected earlier were not supposed to be infected again. So there have been reports from Korea and other countries that they have been infected again. They got infection. So there could be a chance that this virus will survive, and we have to maybe, which is why this is said this is the new normal.
So,
Until
hmm.
immune to herd immunity is created, so everybody gets safer. But we cannot say anything about it at this point because nobody can say anything about it.
Okay. So, Ahmad Deen is asking that I heard that virus mutates after some time, so it becomes more dangerous. So, is it true?
Um, some of the reports which we were discussing the other day, and it's a research that hasn't been like public yet, talked about it, and they said the strain, you know, uh, in different parts of Pakistan is less virulent. Manan, if I'm right, if I'm correct me if I'm wrong.
Yeah,
Um,
yes,
less.
you are quite right. But there are some researches that I've come across that the strain in Iran and the strain in China and the strain in Italy were different. Uh, but the pandemic, we all know, started in Wuhan, the Hebei province of China. How come the other strains are now different? Now the possibility is that the pandemic started from 2 or 3 different sources, or the virus mutated. So nobody knows. Uh, we cannot trace the evidences.
Hmm.
We still don't know the patient zero. It's a pandemic. There are no easy answers in pandemics. Even our teacher haven't experienced in their lifetime. Even the teachers of our teacher haven't come across such a
Hmm.
situation. This is new. World was so unprepared for this unprecedented event. Uh, uh, Answers are
Yeah,
simply not easy.
exactly. So, Shafaq is asking that is it fine to eat food from restaurants in this situation?
Uh, we don't advise that. But the restaurants, if they are practicing all the preventive measures, do not go sit at the restaurants. Just take away and just be careful with the handling of the plastic bags or maybe whatever the containers that you get food in. So be careful with that. It's okay to order food, I think, until now. And that's how it's been. It's very tricky question.
Yeah.
Yeah.
So, Amir Hamza Rauf is asking that is there really any vaccine ready for this virus?
There is a hopeful news. I just read on the BBC website the Mr. Hancock, the Health Secretary of United Kingdom, uh, announced some 5 hours ago that Oxford health specialist will start human trials of a vaccine coming Tuesday, right tomorrow. Uh, so there are hopes, but as far as I have heard the specialist, uh, many specialists, the Gavi, the vaccine wing of WHO director says that it will take 1.5 years. If we expedite the process, it will take at least a year. There are contradicting news. I don't know, but usually vaccines for coronavirus and such vaccines takes decades. Uh, so
So
again,
let's just
the
hope
answer
for
is
the best then.
for the best.
Yeah. So someone asked that why people are now taking it a less serious issue, and how to ensure implementation of standard preventive measures.
This is
I think
this
we
has been
already
observed.
answered this.
Yeah, this is one of the major concerns that we discuss
Mhm.
most of the time in meetings. Because the other day when I was actually driving through Islamabad, I realized that there are more traffic than in past few weeks. I would want to convey this to people that this is not over yet, and this type of behavior might uh, give an explosion to the spread of the coronavirus. They still need to be very careful. They still need to be very cautious about the spread. It's not over yet. It is as dangerous as it was. It was here or it was across the world. It will remain dangerous until we have, you know, proper treatment and vaccine for it. So be cautious about it for everybody. Like this is the message.
Yeah. So, Dr. Manan, what do you say?
Uh, exactly. Dr. Zaeem has clarified. Let's not have ease. Actually, this may cause an explosion, as he mentioned. People are taking it easy now. Now they are getting acquainted with the situation,
Hmm.
and they are um, uh, bored in the quarantine and isolation. And they don't know. Nobody has educated them. They don't know the pathology. They don't know the risk.
Hmm.
Government just impose the lockdown. Then just know that this is a viral disease, and this way this transmit. But actually, the lockdown has benefited us in a way that the people don't fear now. The number of cases are way too low than the expected cases. That's
Hmm.
why that may be one of the reason people in Pakistan in the developing countries usually underestimate things, and the literacy rate is low. Uh,
Hmm.
they are contributing factors. Um, uh, Again, uh, lockdown cannot be imposed for a lifetime.
Yeah.
People won't sit at their homes, and government realize this. That's
Yeah.
why lockdown is the only solution at the moment, but that's not the ultimate
So,
solution.
so in short, we should all follow the instructions of governments because they are working for us, and they are making sure our, safety. So we should follow that. So, so there is a very interesting question. So someone is saying that is this virus too much harmful for Pakistan or not?
Um, it is as harmful as for anybody else
Yeah.
across the world. Statistics are somehow interesting in the context of India, Bangladesh, Nepal, Pakistan. The surge, if you look at how it was when it started in different countries. For example, there are countries outside Pakistan, of course, outside Pakistan. There are cities where it started as early as in Islamabad or as early as in Karachi, but it exploded exponentially. But here in Pakistan, it's somehow different, and same is the case with India, same is the case with Bangladesh. It is slightly different in these countries, but the reasons are unknown, and we cannot claim it right now.
Okay. So I guess we have just 2 minutes left. So, Dr. Manan, what suggestions would you give to the public as they seek to comply with government policies related to fighting COVID-19?
The government is already taking some precautionary measures, such as enforcing a mandatory lockdown to help curb the spread of this infection. It's also trying to bring in economical stability, strategize to help the poor, and such as the initiative of the SARS program. However, I feel the public should rather must cooperate with the government. We must comply with the government imposed restrictions. We all should obey the orders. The hour of hardship will pass soon. We all are together in this. We should take care of personal hygiene and minimize or totally avoid the social contact. Social distancing should be practiced in true sense. Nobody should store food. Otherwise, nobody else but the poor, the middle class, the lower class will feel the heat. And one more thing, the main strategy that we can combat this pandemic is to identify, trace, and then isolate the positive cases. Yesterday, it was somewhere in the news that a COVID positive person ran away from a quarantine center somewhere. Later on, that person was arrested and then isolated. And such incidents create so much hardship for the government, for the health department, for us, the doctors, the health professionals. Such an incident, the famous case of a medical technician returned from performing Urma in a village of Mardan with the name of Manga, who died later on and came out as a positive case. But as he had kept his symptom in told nobody, just due to this one incident, the whole village became infected. I guess a population of more than 2,000 or 3,000. We can cooperate in this regard with the government. I mean, there is much we can do on our part. Government is not responsible for all the things. As I said, government official cannot come to our homes and force us to wash our hands, impose good hygiene measures. I mean, we have to take the responsibility. After all, it's our lives, our health, our loved ones will get infected. You know, asymptomatic COVID patient can even transmit. I am repeating this again. We should make it a habit to comply with the basic hygiene and stick with the government policies. And I hope we will come out of this pandemic even more stronger and hope for the best, inshallah.
Yes, let's hope for the best. And thank you so much, Dr. Manan and Dr. Zaeem, for joining us today for this live session on COVID-19. And I'm so thankful to you. And I would like to say a big thank you to our audience for watching us today. And I think we addressed as many questions as we could. So I hope we get out of this pandemic very soon. And we should all follow the instructions of government. So that we come out of this pandemic, as soon as possible. So take care of yourself and thank you so much once again. Allah Hafiz.
Allah Hafiz.